Greetings and welcome to this yet another video on Clinical Pharmacology Series. In this video, we'll try to master the analgesic decision flowchart. That means what you have to choose on what time and what type of comorbidity and the pain pattern. So, firstly, we'll try to identify the pain type, then check for comorbidities, then choose the drug and its safety net. Now, this video is completely for educational purposes. This is medicine beyond Harrison's. Let's get started. So firstly, we'll try to identify what is the pain type. So it is classified broadly into four types, which is inflammatory, non-inflammatory, neuropathic, and severe. In inflammatory pain, it is musculoskeletal pain, which is like osteoarthritis, joint pain, fracture pain. Other types of pains are rheumatoid arthritis and osteoarthritis. In non-inflammatory pain, which is caused due to fever, generalized myalgia, headache, these are non-inflammatory pain. Neuropathic pain is basically burning or electric shock-like sensation, peripheral neuropathic pain, trigeminal neuralgia, those kinds of pain. And finally, there is severe type of pain, especially in trauma, cancer, or post-operative patients. So, based on these broad categories of pain, we classify their drug or the analgesic of choice that is used, and also considering the patient comorbidity pattern. So step one, we'll choose the screen of choice, the default drugs for each type of pain. Severe pain, it is the opioid that is always chosen, which is Tramadol initially, which is a weak opioid. Then we'll go for oxycodone or morphine. Then finally, fentanyl. Fentanyl, remember, it is 100 times efficacious than morphine. So for inflammatory pain, we choose NSAIDs because it can reduce the prostaglandins and reduce the inflammation as well as reduce the pain. So always consider giving proton pump inhibitor along with the NSAID for gastroprotection. The most useful NSAIDs among these category is naproxen or ibuprofen. Neuropathic pains are gabapentinoids like gabapentin, pregabalin, duloxetine, or tricyclic antidepressants like amitriptyline, nortriptyline. Non-inflammatory pain, the safest initial choice is the paracetamol. If not responding, then we'll go for other types of analgesics. So check for the comorbidities of the patients. The comorbidity is the most important determining factor for the choice of analgesic. It is the filter, the first filter that we will apply before giving an analgesic. So for a patient with the kidney disease like acute kidney injury or chronic kidney disease, it is imperative to avoid NSAIDs and morphine. And we usually prefer paracetamol up to 2 grams to 3 grams per day. And we can also give fentanyl or low-dose tramadol. In case of cardiovascular disorders like coronary artery disease or stroke, it is imperative to avoid diclofenac or etheric oxide, which is a COX-2 inhibitor. Diclofenac is the most cardiotoxic NSAID, and we can prefer naproxen with a GA protection and paracetamol. In case of pregnancy in third trimester, avoid NSAIDs. It is due to it can cause premature ductal closure. And also avoid opioids. It will cause decreased uterine contractility and fetal distress and fetal decreased fetal movements. In case of liver disease or in cirrhosis, avoid NSAIDs, avoid high dose opioids. Even for paracetamol, it is only up to 2 grams per day. We can give fentanyl. In elderly more than 65 years, try to avoid amitriptyline because it can cause delirium as well as urinary retention and other muscarinic actions. And also prevent using indomethacin as it can cause high potency to cause acute kidney injury. Yeah, it's always paracetamol is preferred. If paracetamol is not resolving the pain, go for topical NSAIDs like diclofenac gel like that, so that they will be benefited. So in pregnancy also, paracetamol is the safest. So final drug selection part, which is if the patient is having only mild pain with the fever, you start with paracetamol. If inadequate, you can go for low dose ibuprofen or naproxen. If there is no CKD, GA, or cardiovascular risk. If it's an inflammatory pain like OA, RA, flare, or dental pain, and always check for the risks if there is CKD, cirrhosis, GA, bleed, or coronary artery disease. If there are risk factors, then avoid NSAIDs. Go for paracetamol plus or minus tramadol. If there are no risk factors, then you can go for NSAIDs, preferably naproxen or ibuprofen. If there is high GI risk, add a PPI or etheric oxide. If there is high cardiovascular risk, prefer naproxen. In case of renal colic pain, it is first line is diclofenac IM injection. If contraindicated, go for fentanyl IV or tramadol. Nowadays, even ketorolac is given as IM or IV to for renal colic pain. For neuropathic pain, like trigeminal neuralgia, peripheral neuropathy pain, gabapentin or pregabalin is a preferred, or duloxetine can be used if there is no liver disease. Second line is amitriptyline, which is a tricyclic antidepressant. Try to avoid this in elderly patients in order to prevent delirium or urinary retention. For trigeminal neuralgia, specifically carbamazepine is used, not for other neuropathic pain categories. In case of severe pain, start with opioids, which is a weak opioid like Tramadol or Tapentadol. Then you can escalate up to morphine. Ensure to avoid morphine in case of CKD patients, which will lead to accumulation of M6G metabolite and cause a severe CNS depression. In case of unstable or CKD patients, you can go directly for fentanyl. For chronic cancer pain, it is imperative to use fentanyl patches or oxycodone patches. So check red flags before prescribing an analgesic. GI bleed risk, avoid NSAIDs, especially COX-2 inhibitors like uricoxib and celecoxib. Avoid NSAIDs even if NSAIDs being given. Try to give it with a proton pump inhibitor, character agent. In case of CKD or acute kidney injury, avoid NSAIDs and morphine. In coronary artery disease, avoid diclofenac and uricoxib. In asthma or patients, avoid aspirin, which will cause increased polyposis, and also NSAIDs. In special populations like elderly or increased risk of falls, avoid tricyclic antidepressants. In case of patients with epilepsy, avoid Tramadol. Opioid naive patients, avoid fentanyl patches. It can cause sudden onset hypertension. The side effect monitoring. The common culprits are NSAIDs, opioids, and paracetamol. Paracetamol, if given more than 4 grams per day, it can cause liver toxicity because of accumulation of NAPQI metabolite and depletion of glutathione, which is an antioxidant. So, in case of opioids, the side effects can be like respiratory depression, constipation. For constipation, you can give a laxative along with opioids, and it can also cause nausea. For NSAIDs, it is a GA bleed risk, renal failure risk, peripheral edema, cardiovascular risk. All things are high. Try to avoid NSAIDs if it can be done. So, specific agents like morphine can result in histamine release. It can cause hypotension or itching. You can use fentanyl in these situations when there is hemodynamic instability. Fentanyl does not cause histamine release. So a patient is on non-adrenaline support or inotropic support and also needs sedation for intubated patients, mechanically ventilated patients. You can prefer fentanyl instead of morphine. Methadone it will cause QT prolongation. Gabapentin it can lead to sedation and edema. That's why it is always advised to take 3 hours before bed so that the next day morning they wake up fresh. Mitriptyline can cause arrhythmia and dry mouth and also urinary retention. So this is any side of this presentation. Start with the paracetamol, escalate to NSAIDs if appropriate, considering all the comorbidities, risk factors, and the need for NSAIDs. Add a neuropathic agent if there is a burning type of pain or neuropathic type of pain. Escalate to opioid only for severe pain. Always avoid NSAID in the CKD, heart diseases, and cirrhosis. So in this video, we learned about the basic types of pain, the types of analgesics used, and its contraindications, and the factors to be considered before choosing a type of analgesics. And we will continue this series with the next upcoming videos in the same topic of analgesics. Thank you for this. Thank you for now.